Hey everyone, welcome. I'm Laura ONB. Thanks for joining us tonight. So this is a little impromptu class. I've been getting a lot of questions about what is all of this airway talk that you're mentioning? Like, what does that really mean? What's going on? And so to start, I wanted to share with you all that really this is the kind of thing that until you have a personal encounter with it, you just cannot even begin to imagine or fathom what all this involves. So I wanted to share with you tonight, full disclosure, I'm a wife, I'm a mother, I'm a high school teacher, and we own our own health and wellness business. But most importantly, I come to you from the perspective of a patient, and much of what I've learned is just in the position of being forced to do research so that I can best advocate for myself, as well as being under the care of a world-renowned surgeon for a couple years now, and I've learned so much from him. And I guess lastly, I've also been in the position to be in the hospital quite often, meeting different patients, and that is something that I'm really good at. I'm not a medical doctor. I don't have that expertise or knowledge experience from the doctor's perspective, but I'm really good at making friends and hearing their stories and learning from them. And so that's what I'm here to share with you tonight. So first of all, as I said, I'm not a medical doctor. I'm not here to suggest that I can diagnose, treat, heal, cure, or any of the above. I'm just here to give you some basic information about subglottic stenosis. And this is definitely the kind of field where once you start stepping into it, it's the thought, the more you know, the more you realize you don't know. So I'm just going to share with you some of the basics. So subglottic, that word means below the voice box, and stenosis means narrowing. So subglottic stenosis is where the airway starts to narrow below the voice box. And another word that is often associated with this type of disease is idiopathic. Idiopathic means that there's not a real known reason for the origin of this illness. Now, sometimes idiopathic is used, but we still have an insight that perhaps it's related to acid reflux, or perhaps it's kind of fueled by hormone problems, or sometimes it's an actual cancer, or it could be something like my condition, which is called amyloidosis. Amyloid is when there's been some sort of infection, and the antibodies that fought that infection kind of go rogue. And instead of dying and the body metabolizing them properly, they just build up like putty, and over time that airway just gradually narrows. Another reason that we can have narrowing is due to some sort of scarring process. Sometimes that is from acid reflux. The acid is actually getting into the airway and creating scarring, but sometimes it can come from other things as well. Sometimes this is a result of radiation that was used to treat something else. But still, you know, that scarring mechanism can create buildup that causes the airway to narrow. So this is the kind of thing, as you think about all of those potential causes, a lot of times this comes back, and it comes back over and over. And until those different areas of health are really fine-tuned so that they're working properly, this has to be very closely monitored so that that scarring can be removed and the airway can be managed so that safety first is happening, but then the functionality of the voice box is in place as well. Now, bear with me, I've got a couple cameras going here and I have some notes to share with you. All right, so subglottic stenosis is probably the most common type of airway stenosis, but this can take place even below the subglottic area, further down into the trachea. And when we get into the trachea, we're now into a different zone of the body, right? Instead of being in the head and neck region, we're now into the chest cavity. And then below the trachea, stenosis can even happen in the bronchi, which branch off into your lungs. And so anytime there is narrowing in that region, that's where you're going to get shortness of breath and a whole plethora of different types of symptoms that come and go. And typically they tend to progress and worsen if the disease is not well managed. So the subglottic area is really important because it's kind of this bolus area, from going from the neck region outside of the chest cavity into the chest and thoracic region. So it's really important that that area is monitored well. Some of the symptoms that people who are struggling with airway stenosis can experience are shortness of breath, and that definitely tends to worsen if there's stress. One of the common stress responses is that the airway closes naturally, right? Well, if you're already struggling with that and you're stressed and the airway further closes, you can imagine that shortness of breath gets worse. Other things that can take place are difficulty swallowing. Sometimes we have laryngitis, which I struggle with sometimes still, especially under stressful circumstances. As this worsens, sometimes you'll have kind of like a persistent cough. If the narrowing is at a point that you can't really clear the secretions in the chest, then it can get to a point that when you cough, you're not really able to get good relief. And so that cough kind of nags. At the worst of it, some of the symptoms that you may see are that sleeping is really difficult because even at rest, you're struggling to get your lungs full with oxygen. And so because you're not sleeping well, you reach a whole new level of exhaustion that you didn't even know existed. And then one of the responses to your lungs, your heart having to work so hard to pump that extra blood and keep oxygen into your body, is that your heart rate starts to increase. So you feel like your heart's racing. Now, if you've ever experienced anything like a panic attack, airway stenosis can feel like you're living in a condition of a panic attack, like all the time. And some of the patients that I've become friends with, some of us have dealt with it days, some of us have dealt with it many, many months before we found the right surgeon to take care of us. So this is something that when it's monitored well, this can be controlled. It can be managed, but it takes a really, really special and unique person to be able to do that. And it's not something that has to be the end of life type of sentence. So that's one of the reasons why I wanted to bring awareness to this. Like I said, I didn't even know that the airway could narrow. Who knew that was a thing? I mean, seriously, it's like your whole body has just decided it's going to betray itself and shut down. I mean, what on earth? Okay, anyway, so continuing on. Something else to consider, and if you think about the types of symptoms that I described, is that depression can be really common side effect of this type of disorder that's presenting. And I would just suggest, doctors, in the name of all things holy, let's not slap a depression diagnosis on these poor people. Can we all just agree that if you're not breathing, if you're not able to breathe well, depression is the normal response? That is the body's normal response. And let's not suggest that there is an added diagnosis. Let's instead work to support the body so that stenosis gets under control instead of dealing with an additional diagnosis. Now, something that makes this type of illness really difficult is that lab work can be totally normal. My lab work was all perfect, over and over. Every time I had it checked, it looked fantastic. But the problem was, in order to see the extent of the disease, it took a doctor who was willing to go into the chest and actually look and see what was going on in there. Now, the typical doctor who is going to look inside of the chest, they're going to suggest that you're sedated. Well, as you can imagine, an airway patient being sedated is not an ideal circumstance. So it takes a really unique person who is willing to do this procedure while the patient is awake, who is able to help talk the patient through this type of procedure so that it's manageable and tolerable while the person is awake, and that they can, be okay and comfortable during that procedure. But once my doctor found and looked down into the airway, we could see exactly what was going on. So I would encourage you, I think that subglottic stenosis is considered to be a really rare phenomenon. I say rare, but I know I'm in an international subglottic stenosis group that has nearly 3,000 people in it. So I don't know how rare that really quantifies it to be. But I would suggest that more people actually struggle with this than what is actually acknowledged, because they aren't getting proper care. Um, a lot of times, as these symptoms I described are presenting, the shortness of breath and the laryngitis, they can kind of be divvied off. I did it myself. I'm like, man, I am so out of shape. I've got to watch what I'm eating. I need to exercise more. But the reality was my airway was closing. So I would really love to see our healthcare system turn such that they have a better awareness of this, and that there is a monitoring of it, so that people are able to get better diagnosed and care sooner, because they don't have to live with this type of suffering. All right, so let's move on. Once we have that proper diagnosis, what type of medical treatments are actually available? Well, there are options for just supporting the symptoms. So if this root cause is an acid reflux issue, then we want to find means to help control the acid reflux. If the coughing and the secretions are an issue, then we find ways to help support the body with that. But in terms of the actual narrowing mechanism, that is when the only medical option at this time is surgery. Now, if you find a really specialized person who is experienced and qualified and confident, a lot of times this can actually be done in office procedures without sedation. And I would encourage you to limit surgeries to the extent possible. If it can be done awake, please consider doing that, because the body is just placed into an additional state of stress when surgery does have to take place. And I realize surgery cannot always be avoided. I am the first to step up. I've had 3. But if it can be done awake, let's work towards making that manageable, okay? So the types of surgeries that can look like are, sometimes they can go into the airway and use a little balloon and blow it up, and that's called a dilation. So that actually expands the airway from the inside. Now, when they do this, they're actually going through the mouth. So a incision does not have to be made into the chest. Another option is they can go into the airway and inject steroid shots, and that can help with the inflammation process. And another option is there is the carbon dioxide laser. It is phenomenal, y'all. If surgery has to take place with a scalpel, that is going to create scarring. And that's the root cause of this narrowing, right? We don't want to have to create more scarring for this to be managed. But the CO2 laser does not create scarring. It minimizes bleeding and it minimizes recovery time. And it is a great option for getting all of that buildup removed. That is what was used to remove the amyloid that I had in my airway. Now, because the medical treatment of airway disease is surgery, now these are some of the basic interventions that are used, some of the first lines of treatments, first lines of defense. But if it progresses, it can get to a point that a trach might be needed so that the airway is secured. And sometimes they can even do what's called a resection, where they remove a portion of the trachea, the rings in the front. If the scarring is localized to a certain region, they can actually remove that tissue and actually work to reconstruct the airway so that that scarring has been removed. And sometimes it won't come back. So there are instances where that is an option, and that takes care of it. But because surgery places the airway patient at such additional risk and the potential for a longer recovery time, it is my personal opinion, and as I said, I'm not a physician, it's just my personal opinion that this is an instance where all holistic healthcare options must be thoughtfully considered and discussed with your doctor. Your ability to breathe should not be dependent on one modality of health and healing. And a lot of times that is going to mean a health change, a lifestyle change. It's going to mean cleaning up your environment. It's going to mean removing toxins from your home. It's going to mean focusing on nutrition, focusing on other modalities of health. But this is an instance where that in my opinion, it must be considered. All right, so then lastly, I wanted to talk with you all a little bit about what kind of doctor is actually going to be able to help you with this. Like, who do you go to? Because they don't just label doctors like airway stenosis doctor, right? So you have ENTs, so they're ear, nose, and throat. Typically, the nature of ENT or otolaryngology is that they are focusing on ear, nose, and throat, the head and face and neck above the chest cavity, right? So if your stenosis is truly limited to the region of the voice box, that could be a good option for you. Now, depending on the nature of it, you may need a voice box specialist, right? Because preserving your ability to speak and communicate needs to be important. So there are specialists who really focus on and have excellent expertise in voice box care. Now, if your stenosis is below the voice box, then you're getting into the area of the trachea. There are some ENTs who really focus on throat, and so they will do some work, voice box down through the trachea. But like I said, once we get into the trachea, you're now really dealing with thoracic surgery. And so a lot of times it's a thoracic surgeon who will take care of the trachea stenosis. Once you get into bronchial stenosis, then you're dealing with pulmonology. Okay, so you can see that this type of illness, it's not just a matter of finding a person who's willing to say, hey, I want to do airway patients all day, every day. I mean, we're talking critical care every day. Every surgery is somewhat emergent, right? We're stabilizing the airway. It's not the ordinary bird that wants to step up and do that all day, every day. But you're also getting into this region of care where you have multiple disciplines that are needed. Now, I have been blessed to find Dr. Paul Castellanos. He is one of a kind. He is truly one of a kind. He is an ENT initially, but he has spent decades fine-tuning the skills, techniques, and his expertise in providing care from the voice box down through the lungs. And my airway disease, it was top to bottom. It was widespread. There was a mass on top of my voice box, and there was stenosis all the way through my airway down to the bottom of my lungs. So if I had not been referred to him by my Mayo ENT, and when I walked into the Mayo ENT doctor in Minnesota, after I'd driven 15 hours with a 4-millimeter airway, he walked in and he immediately said, "Why are you here? One of the world's leading airway surgeons is in Birmingham." If I had not found Dr. Castellanos when I did, I absolutely would have died. I had a week to live at that time. And for him to be right here at home has been such a blessing. He has taken care of me. He has restored my life. He restored my voice. And not just that, but he has been such an amazing teacher to learn from. If you ever have the opportunity to learn from Dr. Castellanos, take it. Take it. Whether you are a physician or a patient or just an individual curious, learn from this man. He is such a good teacher. I have watched him in different hospital settings. I've watched him rigged up all different kinds of equipment in emergencies so that he could save a life. I've watched the way that he instructs different staff members, nursing staff, residents, fellows, other doctors, and he is an excellent teacher. So, all right, I'm going to check back through here and see if y'all have any questions for me. That gives you a little bit of an idea of what airway stenosis is, how it's treated, and what type of physician that may be able to help you. But let me check through. Y'all got any questions for me? All right. I love y'all. Y'all are so sweet. Okay. If you do come across questions, feel free to post them here. I will be glad to scan through periodically over the next couple days and see what you got for me. If I don't know the answer, I know someone who can answer it for you. And I appreciate y'all watching tonight. Take care.